Most women grew up hearing they needed a pap smear every year. But screening recommendations have changed a lot, I understand. Can you walk us through what women should actually be getting today and how often?
The pap smear recommendations have changed significantly from what most women think is necessary. So women were brought up thinking that pap smears are a yearly
Yeah.
test, and that still has run into the minds of women till today. The pap smear is done to screen for cervical cancer, and today we have a test that tests also for the HPV, which is the cause of 99% of cervical cancers. Because of that, and knowledge regarding how the cancer progresses over time, the current recommendations are no pap smears before the age of 21, and from 21 to 29, the pap smear alone is done every 3 years. From 30 to 65, the pap smear is done combined with the HPV test every 5 years,
Wow, that
as
has
long as it's normal. Now, these are the
right.
guidelines for normal tests.
That has really changed since when I grew up and started
Yeah.
having these tests. Okay. Now, HPV vaccination that you just referenced has been around for a while now, but I know there's still a lot of confusion out there and some hesitation among parents and adults who should be getting the vaccination. And is there an age where you're too late?
So the HPV vaccine came around several years ago, and there's no doubt that we still struggle getting the children vaccinated and the teens vaccinated.
When do you start?
From the age of 9 to 11, or as early as 9, but 11 to 12 is the ideal age. So as early as 9, 11 to 12 is when we pretty much do most of the vaccination. And then you can catch up until the age of 27.
Okay. And there's a booster with that, right?
So the vaccine depends on when you're vaccinated. The
Okay.
later you're vaccinated, the more vaccines. So for the younger population, the one that's within the range of recommendations, you have the 11 to 12 years old. Then you catch up before you get exposed to the HPV virus. And until the age of 29, this is only 2 vaccines, one and then repeated in 6 months. After that, if you are up until the age of 45, which can be extended to get the vaccine, your immune system is not as strong. So you would get a third dose, 1 dose repeated in 2 months and then repeated in 6 months. So it's 3 doses for the older population, 2 doses for the younger population. And this covers not only cervical cancer protection, it's an HPV vaccine, which is responsible for anal cancer, or oropharyngeal cancer, penile cancer, vaginal cancer, vulvar cancer, all HPV-related cancers.
Wow.
So it's not exclusively given or should be offered to girls. It's offered to everybody.